Your institution is deploying a fleet of AI agents, one per job. Your patients are now starting to arrive with their own agent, one per patient. And nobody can see both. Nobody can see both in one place, but now we can. And so watch. First thing I want you to note is that I am signed in with my hospital Entra ID, my Entra ID, the same identity that we already govern today. And notice the pill at the top, it's actually flipped to live tenant data. We have a mock data version, but what I want you to see is this is not staged. This is the real agent inventory in this tenant right now. This is your fleet, the institutional plane. Every co-pilot and Entra agent merged, deduplicated, and each scored for hospital importance. Many different agents, one per job. And that fleet now includes Microsoft Scout, the always-on agent, just announced at Microsoft Build. Scout, just like Tula, runs on OpenClaw with its own Entra ID, with its own Entra identity, governed through Agent 365. The halos here show the governance status at a glance. Stale knowledge, blockers, blocked agents are all flagged automatically. And the score is not a vibe. If I click on an agent, this is, you can see this is a real agent. This is a sales development agent. It's a frontier agent from Microsoft. And you can see the score. The relevance is out of 100, built from 5 weighted factors: clinical proximity, operational leverage, risk sensitivity, adoption, and outcome contribution. One click of the refiner's plane allows you to filter and zoom in on individual agents. We can review their importance tier, their governance status, service line, and consent. Your team literally manages this fleet of AI agents the same way they filter a work list. Search works the same way. So if I type D365 in the search box, you can see these are the dynamics, all of the various Dynamics 365 agents, and they've all been scored. What is the clinical proximity? And by the way, this may change hospital to hospital. Some folks are using Microsoft Cloud for healthcare. Those agents will show up in here as well. If Dynamics is integrated with Cloud for healthcare, your score is going to be a little bit higher in the hospital relevance, if you will. So the Dynamics 365 agents come into focus, again, straight from the tenant. So now let's switch the view to the patient constellation. So this is Tula, the patient constellation. And so what you can see down here is we have the swarm divided into various categories: active episodes, admission, inpatient. This is one governed agent per patient, owned by the patient or the hospital. We're seeing more and more scenarios where the hospital may want to spin up one agent per patient to help with things like consent, or maybe do some checking of the patient record, some adversarial checking. You know, is everything the way it should be with this patient in Epic, etc. So here's the connection. Every patient agent built on Tula is built on the same OpenClaw engine Microsoft chose for Scout. And they're all registered in the same Agent 365 control plane. The fleet, the swarm, one set of rules. And this is our special view I'd like to share with you today. This is what we call the trust bridge. What this does is it shows the agents in orbit, medications, appointments, discharge, the pulsing nodes that need attention. And your team sees why before the patient ever calls. The same refiners work here. One click, and you can zoom in. In this case, I'm zooming in on Paul Swider. I'm literally patient 0, the very first OpenClaw agent in the swarm. So watch as I zoom in on my personal Tula agent. You can see the consent state, what's granted, the agent ID, the cohorts, the hospital. By the way, this is designed for a system. So this is actually divided into 4 different hospitals. And by the way, the Microsoft 365 stuff is all live data. What we're looking at here is a mix. The Tula agent is live. for our proof of concept. We've proven that we can divide the bridge or cross the bridge, and then what we do is we spin up a swarm of patients with mock data. So I am literally patient 0, the very first one. And yeah, this is the view that nobody else has, the trust bridge. Every line is a consented connection between the patient agent and one of yours. Expired or blocked, consent servers, if it's expired or blocked, consent severs the line. So you saw me search for one patient, Paul, here's patient 0, and now if there was any blockers, it would show here. And of course I can click on any one of these lines, and it will show me the interaction summary. Here you can see verify patient consent scope before sharing, and it says consent was success, the data sensitivity is high. So every connection has been consented to. Click once and you get the scope, the activity, and the audit trail. The bridge refines too. One click surfaces every connection that needs review across the entire system. And the executive rail over here on the right triggers which agents are mission critical, which need review, and which consent is about to expire. Governance is not a report you run quarterly. Governance now becomes a live view into the ecosystem that you open every morning. That's the observatory, the constellation, the plane, and the trust bridge between them. Your fleet, their swarm, one engine, one governance plane, one bridge. So we'd like to stand this up in your tenant for a 2-week pilot.